A sprain happens when a ligament is stretched or torn. A ligament is a strong fibrous band of rope-like tissue that connects two or more bones at a joint. When you have a sprain, you may have injured one or more ligaments. When you have a sprain, it directly impacts the joint involved. The severity of a sprain can range from the ligament being stretched, partially torn, or completely torn. How bad the injury is depends on both the degree of sprain and how many ligaments are involved. You can have a sprain in any joint in the body, but the most vulnerable spots include those at higher risk of injury from falls and trauma within both the upper and lower parts of the body. The three most common spots for sprains are the ankle, knee, and the wrist. What are the signs and symptoms of sprains? Signs and symptoms may vary due to severity of injury. They may include pain, swelling, which can indicate underlying inflammation within the joint or within the soft tissue surrounding the joint. Bruising, instability, especially noted on weight-bearing joints like the knee or ankle. And lastly, loss of the ability to move and use the joint. Sports sprains can develop from overuse or from force, such as a collision or fall. It develops or occurs when you overextend or tear a ligament while severely stressing a joint. The sports that often cause a sprain include basketball, soccer, and volleyball. Taking a blow to the body, including contact sports that cause a direct hit or a shift in balance and falls. For immediate self-care of a sprain, try the RICE approach: rest, ice, compression, and elevation. Rest. Avoid activities that cause pain, swelling, or discomfort, but don't avoid all physical activity. Ice. Even if you're seeking medical help, ice the area immediately. Use an ice pack or slush bath of ice and water for 15 to 20 minutes each time and repeat every 2 to 3 hours while you're awake for the first few days after the injury. Compression. To help stop swelling, compress the area with an elastic bandage until the swelling stops. Don't wrap it too tightly or you may hinder circulation. Begin wrapping at the end farthest from your heart. Loosen the wrap if the pain increases, the area becomes numb or swelling is occurring below the wrap area. Elevation. In order to help decrease swelling, keep the injured area elevated on a pillow. You should try to keep the injury above the level of your heart.